is day 70 of our 365 today project, and our topic today is acne. Acne or acne vulgaris is a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. It often causes whiteheads, blackheads, or pimples, and usually appears on the face, forehead, chest, upper back, and shoulders. Acne is most common among teenagers, though it affects people of all ages. Effective treatments are available, but acne can be persistent. The pimples and bumps heal slowly, and when one begins to go away, others seems to crop up. Depending on its severity, acne can cause emotional distress and scar the skin. The earlier you start treatment, the lower risk of such problems. Epidemiology. Global acne affects approximately 650 million people, or about 9.4% of the population. As of 2010, it affects nearly 90% of people in Western societies during their teenage years, but can occur before adolescence and may persist into adulthood. While acne the first developed between age of 21 and 25 is uncommon, it affects 54% of the women and 40% of the men older than 25 years of age, and has a lifetime prevalence of 85%. Symptoms. Acne and symptoms of acne vary depending on the severity of your condition. Whiteheads, closed plug pores, blackheads or open plug pores, small red or tender bumps called papules, pimples or pustules, which are papules with pus at their tip. Large solid painful lumps beneath the surface of the skin, nodules. Painful pus-filled lumps beneath the surface of the skin, cystic lesions. Causes. Four main factors are excess oil production, hair follicles clogged by oil and dead skin cells, bacteria, excess activity of a type of hormone called androgens. Acne typically appears on your face, forehead, chest, upper back, and shoulders because these areas of the skin have the most oil or sebaceous glands in it. Hair follicles are connected to oil glands. The follicular wall may bulge and produce a whitehead, or the plug may be open to the surface of the dark end, causing a blackhead. A blackhead may look like dirt stuck in pores, but actually the pores is congested with the bacteria and oil, which turns brown when it is exposed to air. Pimples or red spots with white center and develops with blocked hair follicles, become inflamed and infected with bacteria. Blockage and inflammation that develop deep inside the hair follicles produce cyst-like lumps beneath the surface of your skin. Other pores in your skin, which are openings of the sweat glands, aren't usually involved in acne. Factors that may worsen acne. The factors can trigger or aggravate acne. Genes. Acne appears to be strongly inherited. Genetic explain 81% of the variation in the population. Hormones. Androgens are the hormones that increase in boys and girls during puberty and causes the sebaceous glands to enlarge and make more sebum. Hormone changes related to pregnancy and the use of oral contraceptives also can affect sebum production, and how low amounts of androgens circulate in the blood of women can worsen acne. Certain medications, examples include drugs containing corticosteroids, testosterone, and lithium. Diet. Studies indicate that certain dietary factors, including skimmed milk and carbohydrate-rich foods such as bread, bagels, and chips, may worsen acne. Chocolate has long been suspected of making acne worse. A small study of 14 men with acne showed that eating chocolate was related to a worsening of symptoms. Further study is needed to examine why it happened and whether people and acne could benefit from following specific dietary restrictions. Stress. Stress can make acne worse. Other mechanisms, obstructions of skin follicles with helmets or chain straps can worsen pre-existing acne. Several medications can also worsen pre-existing acne. Examples of such medication include lithium, hydrothione, isoniazid, glucocorticoids, iodides, bromides, and testosterone. Diagnosis. Acne vulgaris is diagnosed based on a medical professional clinical judgment. The evaluation of a person with suspected acne should include taking a detailed medical history about a family history of acne, a review of medication taken, signs and symptoms of excessive production of androgen hormones, corticosteroids, and growth hormones. Common blackheads and whiteheads must be present to diagnose acne. In their absence and appearance similar to that of acne would suggest a different skin disorder. Minor commoners, the precursor to blackheads and whiteheads, are not visible to the naked eye, which inspect the skin and require a microscope to be seen. Many features may indicate the presence a person's acne vulgaris is sensitive to hormonal influences. History and physical clues that may suggest hormone-sensitive acne include onset between age 20 and 30, worsening the week before woman's period, acne lesions predominantly over jawline and chin, and inflammatory nodal acne lesions. Cook's acne grading lesions uses photographs to grade severity from 0 to 8, with higher number representing more severe acne. The scale was the first to use as standardized photographic protocol to assess acne severity. Since its creation is 1970, the scale has undergone several revisions. The Leeds acne grading technique counts acne lesions on the face, back, and chest and categorizes them as an inflammatory or non-inflammatory. Leeds score ranges from 0 to 10. Through modified scales have maximum score of 12. The Pillsbury acne grading scale classifies the severity of the acne from grade 1 to grade 4. Differential diagnosis. Many skin conditions can mimic acne vulgaris, and these are collectively known as acneiform eruptions. Such conditions include angiofibromas, epidermal cysts, flare spots, folliculitis, keratosis, pilaris, milia. Differential diagnosis. Many skin conditions can mimic acne vulgaris, and these are collectively known as acneiform eruptions. Such conditions include angiofibromas, epidermal cysts and flare spots, folliculitis, keratosis pilaris, milia, perioral dermatitis, and rosacea. Among others, skin disorders such as perioral dermatitis and keratosis pilaris can appear similar to acne but tend to occur more frequently in childhood. Rosacea tends to occur more frequently in adulthood. Facial redness triggered by heat or the consumption of alcohol or spicy foods is also more suggestive of rosacea. The presence of comedones helps healthy professionals differentiate acne from skin disorders that are similar in appearance. Chloracne, due to exposure of certain chemicals, may look very similar to acne vulgaris. Thank you.